Hey guys, it's Allie with Allie Answers, and I cannot get away from the sun today. There are sunspots no matter where I go, so we're just gonna do this anyway. If you're new to my channel, welcome. And if you've been here before, thank you so much for coming back. If you have not yet subscribed, please do so that you'll be notified when I upload new videos. Hospice is a benefit that is covered 100% by Medicare and provides medical care in the home. Hospice is appropriate when someone no longer wants to seek aggressive treatment for a disease process such as cancer, COPD, CHF, and we're going to go over those a little bit in a minute. The hospice benefit covers medical care in the home. It is designed to keep your client, patient, or loved one out of the hospital. Hospice covers a nurse coming into the home. It covers home health aides coming and giving baths. It also covers social workers and chaplains and volunteers. It covers durable medical equipment like hospital beds and oxygen, and it covers supplies like pull-ups, wipes, and gloves. Hospice is a blessing for people who need it, but let's talk about who qualifies. Guys, you know that I've said it before. I love my doctors, but if you wait for a doctor to refer you to hospice, you probably are going to be looking at the very last few weeks of life, whereas most people are going to be able to qualify when we believe there is a chance that they are going to only live another 6 months. Now, don't let that scare you. I have another video related to the 6-month question. I'm going to link it below. Take a look, because what qualifies you for hospice doesn't mean anything when it comes to how long you're actually going to live, okay? So check that video out. Now, who is appropriate for hospice? One of the things that I teach people is to look for a general decline. Part of the general decline that you may see is a weight loss of 5% in 3 months or 10% of their total weight in a 6-month period. Obviously, more is fine as well. Someone who is sleeping more hours of the day than they used to. Someone who has unhealed wounds or wounds that will not heal. Someone who is having recurrent UTIs, someone who has to go to the hospital on a regular basis to control symptoms related to their disease process. So someone who's having trouble breathing, who has COPD, for example, and they keep going to the hospital to try to get it taken care of. Someone who is falling on a regular basis. You also might notice that your loved one or client or patient is having trouble getting out of a chair. So maybe when they push up out of a chair, they are in pain and they're having chest pains, or they're having shortness of breath. You may also notice a change in ambulation, meaning maybe they were walking independently and now they need a walker. They needed a walker and now they need a wheelchair. They were able to self-propel in the wheelchair and now they need to be pushed. So that kind of general decline when it comes to ambulation is another indicator that your loved one, client, or patient might be ready for hospice. Often the family will report that they are eating their entire meal, but when you ask them how much is being given, you may find that it's just a little bowl. So it's not a full meal like you and I might eat on a regular basis. It is like a tiny little bowl of grits. Maybe they're eating 100% of that. So when you're talking about appetite, you really want to talk about volume, how much they're eating. Let's talk about the hardest thing to get someone on hospice for, at least in my opinion. This is my opinion. I believe that dementia is the hardest thing to get someone on for, because if they don't have any comorbidities, they don't have other things that are contributing to their general decline, then we really are looking for someone who is not able to express their needs verbally, someone who is not speaking in complete sentences and making sense on a regular basis. We are looking for someone who is not able to get up and go get what they want, someone who is usually incontinent of bowel and or bladder, and someone who needs assistance with ADLs. ADLs are activities of daily living. So someone who needs help with bathing, dressing, grooming, someone who's not able to maybe even eat on their own is more likely, when they have dementia, to qualify for the hospice benefit. It's never wrong to ask. It's never wrong to check, to get an evaluation to see if your loved one, patient, or client qualifies. It's always good to know that when it comes down to dementia, you really do have to show a very declined situation. If they also have something like heart issues, like CHF, if they have COPD, if they have kidney issues, if they have CAD, then it is going to be easier to get them on service. And as a matter of fact, they might just come on with that diagnosis. Your folks with COPD normally are going to need oxygen all the time. That does not mean they're wearing it. So sometimes you will have people where their oxygen level just drops, their oxygenation bottoms out when they get up to go to the bathroom or they do any significant movement, but they are refusing oxygen. So if the doctor asks, are they on oxygen all the time? The real question is, do they need it? With CHF, a lot of times you will see swelling in the legs, and it is often not controlled very well. So maybe the doctor has said take the Lasix every third day, and that's not enough. You're having to do every other day or even every day. Maybe you're taking your loved one, patient, or client to the emergency room or to the doctor to get drained, basically. They're all full of fluid and they have to have all that fluid pulled off so that they can breathe. The fluid around their heart is making it hard for them to breathe. It's exhausting and they sleep a lot. Home hospice can actually help control that. And it's just more an effective treatment when the person is actually being observed more often. Think about someone who goes to the doctor every 3 months and they're seeing the doctor for that 10 or 15 minute period. That's not nearly the same as having a nurse in the home and checking on them and seeing how they're doing and comparing Monday to Friday. If I've learned anything, it's never to assume that a person does not qualify until you dig. If you've been told that the person does not qualify for hospice yet, make sure that you check the link in the description box. I'm going to link a video that discusses that as well. Thank you so much for watching. If you have any questions, please make a comment. I'd love to hear from you. Have a fantastic day. Bye.